is drastically impacted by lags of communication. And communication is something in medicine we have not perfected, unfortunately. And part of the reason are there's so many layers that don't communicate with one another. So if a patient's in my office, I'd like to think it's nice and tidy within my office realm or in that little biodome there. The patient will see me, I have my note, everything's solid. The minute that patient needs now a therapy or a medication or a device implanted, even if it's by me, we have now added 3, 4, 5 layers of different types of communication. And what I mean by that is, let's say we're starting Mrs. Jones on medicine X. If I'm doing that, I now have to provide the patient with medicine X's information. Well, where is that information? Is it a flyer in my office? Is it something at the pharmacy? Is it something I have to call the representative and say, hey, I need some information. Hey, I need a copay code. Hey, I need a copay card. These are all potential delays in communication. Once that's done, I now have to deal with the second layer, which is the pharmacy. And then I have to deal with the third layer, that is insurance. And God forbid we're talking about installing or implanting a medical device. Now we're talking about coordinating with multiple doctors, primary care, cardiology, neurology. We're talking about co-coordination now of 10 different little microbiomes. And the layers of this onion have just become insane. And this is all just for one patient. So you can imagine every one of those steps is not seamless. Every one of those steps is a potential lag in communication, starting with potentially the help, the therapy that I could receive from my pharma rep, my medical device rep. Then the layers of that continue to grow. Insurance, dealing with the pharmacist, dealing with other physicians, dealing with the OR, etc. Now, each one of those steps, with all the technology available to us, I've seen it done in other industries, you've seen it done in other industries, we should be able, with a click of a button, to be able to co-communicate with all these different layers and get the patient on track quickly without that patient then having to call my office 10 times. Dr. Mehra, what happened? I saw you yesterday. I saw you last week. What's the prognosis? What's the diagnosis? What's the treatment? Am I having surgery next week? Whatever the case, and my staff has to call the patient back. Well, we're waiting for the pharma rep. We're waiting for the copay. We're waiting for the surgery center. We're waiting for insurance, and so on. So you can just imagine that's one patient I just walked you through. So imagine in a busy day, if I'm seeing 25, 35 patients, all the layers behind each patient, not to mention the individual patient's needs. Now, if anything can be done to streamline that, to fix that, to let the systems communicate with each other, if there was one platform that synced with my EMR, or if I could communicate with representatives effectively, rather than telling my MA, who then calls the representative calls her back, she ping-pongs me back, she texts me now because I'm in the OR. I mean, just imagine the half a day has already gone by. So at the end of the day, these communication lags are huge. Patients have sort of unwillingly accepted this. They sort of say medicine's broken, it's frustrating. If I talk to you today, I may not get an answer till tomorrow, I may not get an answer till next week. But imagine if other industries work that way, they wouldn't survive. If you had an injured pet, for example, you go to the pet ER, things are taken care of pretty soon, or you at least have straightforward answers. If you need your groceries or food delivered, it's dealt with like that. And so while I understand the human body and medicine is not as simple as that, there's no reason that those different platforms cannot communicate with each other. I'm tired of the different industries hiding behind the fact, well, it's a HIPAA compliance issue. Because the reality is there's plenty of secure methods that can be taken to ensure that things are HIPAA compliant, and yet they could cross-communicate and co-communicate with each other to make all of our lives better and to get patients the best treatment they need.